Hi, my name is Susan Mingle. I'm the clinical educator for Med1 Group, and I'm here today to provide a demonstration on the Sigma Spectrum Infusion system manufactured by Baxter. As you can see, the device is very small, it's lightweight, compact, and it's very easy to use. It weighs in at just a little over 2.2 pounds. Like most IV pumps, this is a smart pump, meaning it has dose error reduction software. This device can have up to 5,000 drugs across 32 profiles. A profile is simply a care area where you work. For example, NICU, PICU, oncology, ICU, med-surg. It has the capability to also have 400 clinical advisories, which is simply a post-it note to the nurse to follow a practice or a protocol around that particular drug that they have chosen. The flow rate ranges on the Sigma Spectrum are from 0.5 to 999. The KVO rate is anywhere from 0.5 up to 50. Those are configurable depending on your hospital's practices and protocols. So I'm going to show you a little bit on the back where the IV pole clamp is, and it's simply just you unscrew it to take it off, screw it to put it on, and then your power cord. Now, in some scenarios, like an ICU, you may see up to 6 pumps being used. So if that's the scenario, then you would obtain what's called a bracket, which will house 3 of these devices at a time. So it makes it very neat and a very organized fashion for the nurses to monitor the IVs and program the IVs. So now we're going to take a little closer look at the front of the device. So now that we've moved in a little closer, I'm going to show you a little bit about the front of the device. This is the large LED screen. You have a row of blue buttons here, which are called soft keys, and they'll correspond with a prompt once we turn the device on. And then just below that, your on off, your setup, your OK, your run stop, and then below that is your alphanumeric keypad. And just to the right of this is where we're going to be loading the tubing in the next segment. So I'm going to turn the device around. Show you the back. This is your battery. The batteries come standard, and then once they're delivered to the hospital, they will be configured to turn the wireless part of it on if it's a wireless environment. This particular battery is called a dual antenna battery, and it is an ABGN wireless battery. There are BG wireless batteries, which only have 1 antenna, and then if it's a non-wireless facility, they would have no antennas. So now we're going to review priming, and then we're going to be loading the tubing. But first, let's talk about the disposables. You have to use a Baxter set. They're proprietary for use in a Sigma device. They offer multiple configurations. For example, 1-port, 2-port, 3-port, a filtered set, or blood set. So now what you want to remind yourself to do is close your roller clamp, spike your bag, 2 good squeezes on the drip chamber. If you're squeezing it multiple times very rapidly, you can build up air in the line. And it's recommended a very slow prime, opening your roller clamp up very slowly. If you are going to be using any ports for this infusion, then you'd want to tip those ports and tap the air out of them, because if you don't and you do use them, then you could possibly introduce air into your line. Now, what you also want to remember is that what we call the blue slide clamp or the key, you want to make sure that it's 12 to 15 inches apart from the drip chamber. So now we're going to load the device. Each of the Baxter sets have what's called a key, and it's blue. The key fits on top of the pump, and it's a keyhole where it fits in. And you'll notice there's a notch, and you want to make sure you line that notch up with the notch in the keyhole. So I'm going to slide it down, load it into the keyhole, and it will open up the device for you. And this will do a diagnostic showing you your power status, and then a little map here that's you're going to follow how to load steps 1 through 4. When you've completed it correctly, you'll get a check mark. There's 2. And then we're working on 3 and 4. And then we're all checked off. Now it's going to tell us to close the door. And then to run, we want to make sure we pull up on the clamp to open it and pull it up and back so that we have released that. It's like a second roller clamp. And then next, we're going to program a IV maintenance fluid. So now we have our tubing loaded correctly. And the first screen you'll get is this a new patient? So you'll use your soft keys for yes. Then it will show you your care areas. And again, you may have more than 2. This is just our sample library. If you need to change it like you wanted med surg, you would just use your toggle down. But for our purposes today, we're going to use critical care. And then you just say okay. And then we're going to do maintenance fluids first. So to access those, you press I and V. And because I is the 3rd letter, we hit this 3 times, G-H-I, and then V, it's the 1st letter, so we only have to hit that once. And then you'll see we just have 2. Most hospitals will have many more than this. So I'm going to do normal saline, so I'll toggle down, press OK. Now you see that the rate is highlighted. I'll start with the rate of 75, press OK. Volume to be infused is highlighted. I'll underestimate and put in 950. Press OK. And then I'm going to show you a trick here. I want to show you an occlusion alarm. So I'm going to clamp my tubing. And then I'm going to press run. And then you're going to see what the alarms look like on this device. They are red. And this says that you need to eliminate the closed clamp, kink tubing, clog filter, or dotted catheters. Restart is automatic. So I realized that I forgot to open my roller clamp. I just kind of wanted to show you what the alarms look like and that they troubleshoot for you. Now you move to this bitmap, making sure your clamps are open, your tubing's not kinked, and you have drops flowing, which we do. Press yes. And now it says your primary is infusing, normal saline with a rate of 75, remaining volume of 950, and a time to deliver that 12 hours and 40 minutes. These screens will toggle back and forth between those information. So now we're going to program a bolus, and I'm going to manipulate the numbers just so that you can see what happens when it's completed. So I'll use the soft key, highlight bolus. I'm going to do a bolus of 15 mLs, okay, over 1 minute, okay, and press run. And so now our bolus is infusing, and it will count up to the mLs I typed in. On the left upper corner of the screen is an icon indicating that the battery is being charged. It's plugged in. You see the little plug, and it toggles back with how much battery's in there, battery life. And then on the top right, you see the icon for the wireless. It has an X right now because we're filming in a non-wireless environment. If you are in a wireless environment, the X will go away and this icon will turn green. So now you'll just see it continue to count up to the 15 mLs I programmed. Once it reaches the 15, it will automatically flip back over to the programmed rate of 75 that I initially started with. Bolus complete. There we go. We're back to the primary rate of 75. So now I want to show you what a KVO rate looks like. And again, I will manipulate the volume to be infused as if it's almost completed. So I will take the Review Edit blue key button, press that. I will go to the Edit VTBI, and I will change that to 0.5 just so we can make this happen pretty quickly. And press OK, and then press Run. We can look real quick at these blue soft keys. They're saying Rate Change, Info, and Settings, Review Edit, which is what I chose, and then Bolus. Okay, so here's our KVO, which this device is set to 5 mLs per hour. So I will press Stop. Put in my new subsequent bag, program my 950, and I will press OK, and then press Run again. And then again, here's an example of what's called an upstream occlusion. Again, the alarm is red. It's troubleshooting, saying make sure everything is unkinked, above, then push run. And this is your silence button, which will be your favorite key. So you press that while you're troubleshooting, and then press run. Checking to make sure your clamps are open, it's not kinked, and you have drops, press yes. And now the primary is infusing. So now we're going to program a secondary infusion. You just want to make sure that you're lowering your primary now, spiking your secondary bag, and hanging it above the primary infusion. So we're going to press run stop. We're going to hit our program primary secondary, and then program our secondary. Just like we did with maintenance IV fluid, we're going to be using the alphabet key. So I'm going to go to A, B, C, and then hit D, E. We're going to be using ceftriaxone. It's the only drug that we have in our demo library. So I will toggle down and highlight that, okay. Then I'll go down to 2 grams and 50 and say okay. This is just confirming that the concentration I chose is what's on the bag hanging above, and I'll say yes. A clinical advisory just advising me that this is already pre-mixed, and I'll say okay to that. And then it's highlighted the time of 30 minutes, so I'll say okay to confirm that's what time I want to give it over. Then I'm going to press run. Before I press run, you're going to get a message that says, do you want to be called back at the end of this infusion for a line flush? If you want to, you press yes, but for this demonstration, we're going to say no. And then I'm going to go ahead and press my run stop. And then I'm going to validate that my secondary drip chamber, the drops are falling from that, not my primary drip chamber. So I will say yes to that. And now my secondary bag is infusing. Our secondary infusion is complete, and it automatically flipped back to our primary infusion that was running at 75 mils per hour. So now it's the end of your shift and you need to get your totals. So you will press the blue review button, and on the right-hand side, gray at the bottom, is the total given. So you would want to chart that and then clear your total. So it's now been cleared, and then the next nurse for her shift will have a clean slate. And then one other thing I want to show you is how you lock out your keypad. You lock out your keypad by pressing the numbers 4, 2, and 9, and then you will get the prompt there that says your keypad is locked, and enter code to unlock. And if you push any button while it's in the locked, it's just going to keep popping up. You can't really do anything. To unlock it, you push the exact same numbers, 4, 2, 9, and now our keypad is unlocked. So now we're going to program a drug that's in the drug library to show you the safety software that's built around all the drugs that are within the library. So we're going to press run stop, and we're going to clear this program. Yes, I want to clear the program. It's going to take us back to our critical care profile, which we still confirm. And then now I'm going to show you a dopamine infusion. So we type the D 1 time, and then MNO, so 3 times to get to the DO drugs. And if you notice, there's tall man lettering, so any sound-alike or look-alike drugs will be clearly differentiated. So I will use my cursor, toggle down to dopamine, say OK. And there are multiple concentrations. I'm going to choose 400 and 250, say OK. And again, validation that what's hanging is what I chose as the concentration. I'm going to say yes. And an advisory is just saying that the dopamine is pre-mixed. You may see some other clinical advisory in your facility, but just confirm it and press OK. Now put in the patient's weight. I'll just say they weigh 75 kilos. I press OK. And then they're wanting me to confirm that weight again, 75, OK. And we're going to start with a dose of 2. I'm going to press OK. We already know our bag size is 250, so I'm just going to press OK. And then we're going to press run. And again, double checking that you have no clamps closed, your tubing's not kink, and your drops are flowing from your bag. Say yes. And so now our dopamine at 2 mics per kg, it's 5.6 mils per hour. So these will be the screens that will be toggling back and forth. So now we're going to program a dose change or titration. So we're going to hit the dose change button, and we're going to take this up to 2.5, but I'm going to purposely miss the decimal. So I want to show you your limits. So here's an example of hitting a soft limit. It says above the upper limit of 20, do you accept this, yes or no? So in this instance, I'm going to say yes. Let's just say the patient's condition warrants it, and you have a physician order, okay? So you press run. Not only does it give you an alert for hitting the soft limit, it's giving you an alert because that titration dose increased that by 23 mics per kg, or almost 1,000% rate change or dose change. Do you want to accept those changes? Again, it's just another safety stop for the clinician to make sure I have an order, the condition warrants it, and you can still say yes because you initially hit that soft limit. So now it's in red because you are in an override on a soft limit. That's why it's in bold red. So now let's say I am going to decrease this dose. And again, this is just to show you hard and soft limits. So we're doing some crazy programming right now. So I'm going to change the dose to what I thought was 5.5. And I'm going to miss the decimal again. And I'm going to say, okay. And now, this is what we call a hard stop. So you're not able to give this dose at all. So you would definitely have to reprogram that dose. So I'm going to clear that dose. And now I am going to do a dose that would be accepted. And let's just say we're going to go back to 2. I'll press OK. So now your screen goes away from the red. Now I've decreased it exponentially down. Do you want to accept the change? Yes. Just another safety feature to make sure that you are, you do have orders and that what you're doing is by the practice, that you have an order, the patient condition warrants it. I'm just showing you these extreme examples so that you can see what these alerts look like. Hard stop, soft limit, and then those titration safety alerts that when you've doubled or quadrupled a dose. So now we're back to no red screen and scrolling and toggling back and forth the mils per hour and the dose. So I'm going to show you a few detailed features that if you are a super user, you may want to be able to do a little deeper dive into some of the functionality. So let me go back to run stop. I'm going to clear this program. Yes. So how we access those additional features is through the options menu button. So we want to look at the user options, and I'll just press OK. The second one was biomed options. That's for biomed. So the first options you can look at are your alarm settings. So I will say OK. And this is where you can change the audio volume to low, medium, or high. If I want to change it from low to medium, I'll just cursor it up. Then it'll go back to high, then down to medium, and then down to low. So if I'm happy with low, I would just say OK. Then it will move down to the tone. The tone is either a short tone or a long tone. So if you want to increase your tone to the long, you would just toggle it up and then press OK. Now it's going to move to what's called a standby delay. The standby delay is a feature where if you were, say in the OR and anesthesia is doing a heart patient and they're coming off bypass and you just want to delay the infusion for a specific amount of time, then you would type that time in there. So we're just going to leave it at 0 for now and press OK. Near empty alert, you can either enable this on or off. This is if a subsequent bag is due and you need to give pharmacy a little bit more of a heads up, more than what KVO would allow. So you would want to turn that on. Right now ours is set at off, so I'm just going to scroll down. Oh, I have it turned on. Let me go back up to keep it on off and then say OK. And then the pressure limit. So the pump's pressure limits are low, which is about 6 psi, medium about 13, and high about 19. So if you want to change any of those settings, again, you just use your cursor to high, low, and medium. So we'll just leave it at medium, and I'll say OK. All right, so now we're going to look at display settings. So I'll say OK. We're going to look at our run screen options. Audio level indicator is on. It's just showing you if it's low, medium, or high tone for the alarms. I'll say OK that it's on. Rate, it's on. Dose rate is on. Mils, and then the volume to be infused remaining is on. And then time remaining on. Now, I'll go ahead and say OK to this, and just let me tell you that these are configured with nursing and pharmacy. They decide which pages will toggle back and forth. Once they're configured and chosen, they'll be grayed out and you won't be able to make any changes to them. So I'm going to exit out of that now. So one last additional piece of information to know is what's called display adjust. This is simply how light or how dark you want your LCD screen, brighter or darker. So 10 is the brightest, the backlit light, and then you just toggle it down to sort of dim or darken the screen. Maybe for a night shift nurse, they may want a little bit of a dimmer setting, but still light enough you could see the information on the LCD screen. And this was set to default to 10, the brightest, so I'll just push it back up to that. But just know that you can configure that yourself anyway, any number you want, and then press OK. So one other feature we'll talk about is the use of basic, and you really should only use basic if the drug that you're trying to program is not in the drug library. So to do a basic, you're going to still have to confirm the care area because I have already gotten out of the last program. So to do basic, you do A, B, and then A, and basic will come up. You scroll down, you toggle down, say OK. And then it's primary that we're doing, not secondary. If it was a secondary basic, then you would toggle down to secondary. And then the mode of delivery, mils per hour, mics per kilo, per minute, whatever you toggle up and down. I'll just stick with mils per hour and say OK. Then I put in my rate. Then I put in my volume to be infused. And then I press OK and run. And then again, just validate there's no kinks, it's not clamped, which in this case it is. But then I quickly caught that, and we're flowing. Now you see highlighted in red that you're in the basic mode, and again, what that means is you have no safety software surrounding what's hanging. This is the other alarm that I want to talk to you about that can occur. I showed you the downstream and upstream occlusion alarms. This is an air and line alarm. Again, it's saying close your roller clamp, which I'll do. Open the door to assess the IV line for air, and if necessary, unload the set and remove the air. So we'll put our key in, open up the door, kind of check to see, and there's a pretty good sized bubble of air. So I will remove the air from the line. And then I'll put my slide clamp back in. I'll reload my tubing to get my checks, close the door, open all my clamps down below, pull this out, and now I'm going to continue with my infusion. And again, making sure that everything's open and no kinks, press yes. So now I'm just going to turn the device off. So I'll put my key back in, pull the tubing out, close the door, turn the device off. Press and hold off. This concludes our video demonstration of the Sigma Spectrum Infusion System. If you wish to inquire about rent or purchase options, please visit our website at www.med1group.com. Thank you so much for watching.